Ankeet Bhatt, Mike Gibson coming to you live from AHA 2024, and we're talking about a trial with my favorite name, the Nudge Flu Trial. You looked at 2 million people, 3 trials looking at flu vaccine after an MI. Talk to us. What did you find?
Yeah, thank you, Michael, for the kind invitation. As you know, influenza vaccination carries significant morbidity and mortality worldwide. In fact, patients who have cardiovascular disease and acute myocardial infarction are at greater risk for influenza infection and its complications. And in fact, in randomized clinical trials that preceded our study, randomization to vaccination versus placebo not only improved infectious complications, but reduced major adverse cardiac events to similar degrees to more established secondary prevention strategies. Now, despite that, there are large and pervasive implementation gaps in influenza uptake globally, and they're particularly pronounced in high-risk patients such as those with acute myocardial infarction. With that background, we designed the Nudge Flu program, which was 3 randomized clinical trials, all conducted in Denmark, that tested electronic-based letters that nudged patients to receive influenza vaccination. There were 3 trials conducted in the 2022 to 2023 and 2023 to 2024 seasons. They enrolled older participants, age greater than 65 or older, and younger participants with a chronic cardiopulmonary disease that qualified them for free of charge vaccination in Denmark.
What did you find?
Yeah, so we examined over 2.1 million randomizations across these 3 trials. In this pre-specified analysis presented at the American Heart Association, we examined the effectiveness of these nudges in those with and without acute myocardial infarction, a group of just under 60,000 participants across these trials. What we found was really interesting. If you examined any letter-based nudge versus usual care communication, there were numerical increases in vaccination across the board that was statistically significant and consistent whether patients had or did not have a history of myocardial infarction. However, there was one letter-based nudge that really stood out. This was a simple communication, a sentence that was added to the letter, which communicated the potential cardiovascular benefits of vaccination, the so-called CV gain nudge. In that nudge, compared to usual care, there was an improvement in vaccination rates in those without a history of myocardial infarction of about 2%, and a doubling of that improvement, a statistically significant interaction of 4 percentage points in those with a history of myocardial infarction. Mike, just 2 more things that I think really resonate with the audience. This CV gain nudge was even more effective in people who had not been vaccinated in the prior season, those who might be more vaccine hesitant or more vaccine agnostic. In that group who has had myocardial infarction, did not receive vaccination in the prior season, this letter-based nudge compared to usual care resulted in an improvement in vaccination rates of almost 14 percentage points. And then finally, in this really kind of vulnerable group, younger patients who've had a myocardial infarction and have other chronic cardiopulmonary or other comorbidities, we observed that this CV gain nudge also improved vaccination to a greater degree in those people with a more recent myocardial infarction. Those we think are most apt to benefit from early vaccination and consistent vaccination.
Were there enough patients to look at any impact on heart outcomes?
Thank you for that important question. There are 2 major limitations. One is that this study was not really designed to look at clinical endpoints. We expect that the translation of improved vaccination should translate into an improvement in clinical outcomes, but that was not assessed in this analysis. And of course, this represents 3 trials conducted in one country, and so it would be important for other validation efforts in other parts of the world using other maybe more contemporary and more ubiquitous communication technologies.
Well, you can have the best science in the world, you can have the best drugs in the world, but if you're not implementing them, you're not really improving outcomes. So beautiful, beautiful work of implementation science. Congratulations. Love how you scaled it up in a country to get the job done. Thanks for joining us today, and thanks to all of you for listening.
Thank you so much, Mike, for having me.
Mhm.